Hello, can you hear me now?
Yes, doctor, I can hear you. Thank you very much.
Mm-hmm.
So,
I
doctor,
appreciate it.
welcome. So,
Oh,
so,
thank you, thank you.
welcome to the Metabolic Health Conference platform. I'll briefly finish off the introduction. So, we all have the perspective of, what we are doing. So, I'll first introduce about the conference. I'm Shashi, a certified metabolic health coach from D Life in India's first and only award-winning Low-Carb platform. And it was founded in 2014 by Anup Singh, who is from IIT Roorkee, silver medalist and Icons of India awardee. He also pioneered the low carb movement in India long, long back. And Anup's groundbreaking 100 grams of carbs per day max protocol made in 2012 made LCHF or low carb possible for people in India and especially for the vegetarians. So in 2020, he also launched the D-Life Diploma course, the only legally tenable course approved under NSDC Partner, Government of India in the segment. It also has the world's largest 144 CPD hours. So me and Anup Singh, we had co-organized this India's historic low carb conference, the first one in 2023, the second in 2024, and now in 2025. So today we have Dr. Parikshit Sharma. Let me introduce Parikshit Sharma, Dr. Parikshit Sharma. I'll call him, he's the first metabolic psychiatrist of India. So more about Dr. Parikshit Sharma. He graduated in medicine from SP Medical College, Bikaner, and did his residency of psychiatry in CMC, Ludhiana, and fellowship in nutrition and mental health from the University of Alberta, Canada. Practicing as a neuropsychiatrist in Punjab and managing de-addiction rehab center and a special interest in metabolic psychiatry and well-being psychiatry. So today we'll discuss about low carb, food addiction, and psychiatry. Welcome again, Dr. Parikshit.
Yeah, I appreciate it. I appreciate it for your kind words and thank you for giving me time on your platform. I hope this talk today will be like informative, enjoyable, and it will open the new doors for all the people who are looking forward for these kind of alternative treatment methods in psychiatry as well as whole of the body care.
So, what made you connect the dots between the metabolic health and psychiatry? I will also add the link of processed food addiction and all also.
Yeah, the journey started like not gradually, but all of a sudden. I was more into the psychiatry and the de-addiction. What would we generally see all over the world, not only in India, but the curriculum of the medical studies is like that. There is a physician and there is a psychiatrist, and the both are two different creatures. Then the approach wise, how they approach the patient, how they treat the patient, how they diagnose the patients. Still, the taboo is there all over the world about the psychiatric patient, the psychosis, the mood disorders, and everything. Like the physician, I generally used to listen. They say like, no, 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 we don't look for the depression patient. I just refer them. I don't take care of the psychotic patient. I just refer them. And I was surprised how they just know by looking at the face of the patient that he's a depression patient. The depression patient will never say that I have got depression. I mean, this is very recent thing. Like the people listen to the social media and everything, and there is overdiagnosis of depression and the overdiagnosis of all the psychiatric illness. And and the psychiatrists are not keen to look into the numbers. They are not interested in the clinical numbers, the lab numbers, and everything. There was complete mismatch. I mean, the God made the body as a whole, not as a brain as a different entity, and the heart or the pancreas or your skin as a different thing. This is a complete body. When there is some problem inside your liver, when there is some problem inside your blood, when there is a problem inside your metabolism, there must be some effect on the mind. There must be some effect on whole of the body. So mind is not an isolated thing. So I also practice like that. Like we were doing all the diagnosis and the overdiagnosis and the putting the patient all together just by like putting the patient on the drugs and the pills, and even the DSM criteria for the diagnosis of the diseases continuously changing. Like every 3 4 hours, we were getting the new DSM 6, DSM 8, DSM 4, and we went to the conferences and we listened to the psychiatrists from abroad who were invitees, and we were handed over the DSM book, new DSM books by these pharma company guys, and we were just reading it, and the criteria keep on changing. Like when we just finished the school, the depression symptoms must be there for at least for 2 months regularly. Then you need to diagnose it as a depression and the clinical depression, and you can start the drug or start intervention. Then it decreased to 1 month, like like 4 or 5 years ago it just decreased to like the 2 weeks. And now the recent criteria is if you are having these kind of symptoms in a bundle, 3 4 symptom out of these 6 7, and for 7 days you are depressed, start drugs, start taking intervention, which was not I think my opinion as a clinician who is practicing here from the last like more than 15 to 18 years. It is too much into the drugs and everything. And secondly, I was managing the rehab and de-addiction centers. I started practicing here in Punjab, when there was a big epidemic was going on about the drugs from the last 15 20 years, and we set up the de-addiction centers, rehab centers all over the Punjab, and we were treating the patients not only in the indoor but also as an outdoor patients. The one thing which was very significant I have seen in those patients, they always keep some candies in their pockets. They just keep on taking all these sweet candies all the time, and very sugary, syrupy kind of tea after every like 30 minutes. And they were loading their body with the sugars. So that was curious, but there was no relevant research available, and there was no relevant research available online or in our relevant podiums or platforms in the psychiatry internationally or India. Nobody was taking care of that. That why they are taking too much sugar. So out of curiosity, like I started to take their blood samples and started taking their the basic metabolic profile. That is the fasting blood sugars, the lipid profiles, the LFTs. Majority of them were either having the disturbance in the LFTs, in the lipid profile, in their fasting sugars too. But there were only two kind of the patients. Either they were like the lean, very lean, or they were very obese. So I observed like this data is showing me something like that something is going on inside the body. So we generally see like what was there as a clinician. There was observations and there were indications by the government like this type of food you should take, and this are like if you are having liver problem, take plenty of sugars, don't take fried food and oils. You need to take rasgullas. You need to take the sugarcane juice and all this. Like we were always prescribing, but the things were not improving at all. The problem, like for every month, after 4 weeks, 6 weeks, it was the problem was increasing. So then I started more about it, and I get in contact with the certain the group of people who were doing this kind of thing and observing it. They were my all colleagues from the University of Alberta and all over the world, and they were also curious about the phenomena. And the thing which we eventually pointed out, we must check their fasting insulin levels. Oh my God, the fasting insulin level was so indicative that most of them were having very high fasting insulin levels, who are even having the normal fasting sugars. Like they were having insulin levels up to 80s. Can you hear me?
Yeah.
The fasting insulin level was very high. This is a phone call. The fasting insulin level was very high. So we kept on investigating. So eventually we reached to the point where we can clearly see that there is a direct relationship between their metabolic health and their mental health. Another observation we generally see in indoor patients, because in indoor patients, we spend more time with the patient regularly for the long span of time. Like the patient stays with us for 1 month, 2 months, 3 months. So we are more able to observe the total process and the progress. The outdoor patients who came to just take medication and just get the counseling, we spend like 10 minutes, 15 minutes, or up to 40 minutes. if we do counseling sessions. So less information about those patients, but for the indoor patients, we started to do more and more those kind of research, and it is clear that most of the the drug addiction, alcoholic, the patients who are on heroin, the patients who are on opium, the patients who are on like we call the poppy husk or the post or bookie and all this stuff, which is very prevalent in this part of the world. Uh, there is some underlying psychiatric illness also there. So those kind of psychiatric illness, because of that, the people feel uncomfortable and they start taking some remedy in the form of available the street heroin or the opium, or the very popular, the people say you just take 2 packs in the night and you will having good time, and all your tension will be gone, all your problem will they started and they just keep on increasing it. So the basic reason was in most of those addiction patients was the drug, and the drug was there, and underlying that drug there was psychiatric illness, and underlying that psychiatric illness there was metabolic disturbance in the body. So that then the game started, and then I did a fellowship program, and oh my god, that the data I was having, and finally like when I came back and I collected the data. Now the research project is still on in our centers, and with a few of my friends we are at the final stages of that data collection. I will not able to give you the percentage statistics, but definitely, but we will present it at the relevant podiums. But the data definitely suggests that there is a definite link between the food, the psychiatric illness, and the drug addiction and alcoholism. For sure, the connection is there.
That's very huge. And I think it will be exciting once you present the data. It's going to throw probably because not much data I think in India is available.
Correct.
Between metabolic dysfunction, food addiction, to the other addictive part as well as the mental illness. So I think generally in psychiatry and in addiction, of course, I see that many of the psychiatrists also practice de-addiction also. So do they measure all these biomarkers which are important, which we normally do for metabolic dysfunction, either insulin resistance or diabetes or triglyceride or the liver parameters?
Generally, no. Generally, no. People are not interested. I told you the psychiatrist is not interested in these blood parameters. The psychiatrist is not interested in touching any kind of patients. We feel proud about it. Like we have never touched a patient in last 20 years. And I just look at the face and write the drug. Don't talk to me. Even then, I can write the drug for 95% of the time. But alas, the psychiatry is such kind of branch where it gives so much flexibility, and it gives so much liberty to the psychiatrist to diagnose with his own clinical skills, because not much of the so-called tests are available. It is a clinician who judge the patient, who diagnose it with his own clinical skill, and just write the drug. Even the drug profile and the drug profiling is not clearly written in any kind of book. They just mention all those antipsychotic drugs. They just mention all these antidepressant drugs. Now it is up to the clinician to choose it, like what kind of drug it is good for the patient, and what kind of methodology is good for his patients. So psychiatry is a branch which is very flexible. If I always say, like, if you send a patient into a university hospital of the psychiatry, and there are 7 consultants sitting in the different chambers, send one patient in all the 7 chambers, and he will come out with all 7 different prescriptions. I mean, this is very, very common, and the polypharmacy and everything is very common in psychiatry. So psychiatry also gives us very much flexibility at the end of the day to do the well-being of the patient, which we generally do right now, like the well-being kind of psychiatry. But in general, the psychiatrists don't follow any kind of other holistic approaches, or any kind of the blood sampling or profiling, until unless there is a clear-cut signals or symptoms of the disease that they're visible. Only then they will do it. Otherwise, they don't go with it. Maybe they have got their own prejudices or issues. The pharma companies and everything, it is more pushing about writing the drugs. And aversions and everything is not that into the syllabus. Yeah.
So I addressed this question to Dr. Sudhir Kumar also before you. And how does the micronutrient deficiency affect the mental health disease? Do you see it very common? One, is it really assessed by psychiatrists? Two.
Absolutely correct thing. See, most of the time I practice either in Canada or in Punjab. For your information, the Punjab is the population which is highest in whole of the India percentage-wise as a vegetarian. So most of the Punjab is vegetarian, and this vegetarian culture started in late 80s when most of the Punjabis converted to the pure vegetarianism by the religious beliefs and the data cultures and everything which was going on at that time. So most of my population in Punjab is strict, hardcore vegetarians, and definitely the symptoms of all these psychiatric illness and the mental problems, mood disorders, and of course the drugs that all started after that. There is some correlation between them. So the micronutrients, which is well documented right now, well researched, well documented, is methylcobalamin, which is absolutely present only in the meat, red meat especially. The people when stopped at taking the methylcobalamin, which is very relevant for the normal working of the neurotransmitters in the brain, which get deficient, and whole of the pathways of the so many production of either like the serotonin pathways, the norepinephrine pathway, the dopamine pathways, and so many other important pathways that got disturbed. So methylcobalamin deficiency, the vitamin B12 deficiency, is definitely there in the vegetarian population. So that's why, like, it is proven not only in India, in Punjab, also the researches are available that more and more vegetarian population is having the micronutrient deficiencies, and eventually those vitamin and the magnesium deficiencies recently are clearly showing that there is a direct relationship between the mental sickness and the micronutrients which are deficient in your diet, especially the diet which most of the vegetarians taking, which is full of sugars and full of the processed food and grains. So the micronutrients play a vital role. And instead of putting the patient on a right food, the psychiatrist or the doctors are now pushing on the supplement drug and the methylcobalamin supplements, which is again not a good habit and not the long lasting thing. You give them for 2 3 5 months and then eventually they stop, and again the deficiency will creep up and the problem will start. So better to change the food instead of giving the supplements.
Now, are there any guidelines from the Psychiatry Association on the food part? Now we know that for various things there will be some food guideline. So is there any guideline on the food part for those suffering from mental illness and or addiction? Is there any in India or is there any in abroad?
No, not much of the work has been done yet on the psychiatry, especially by the psychiatric associations or the psychiatric the bodies of the doctors or the conference where we go, and we hardly listen to any the food part. The food part is not the psychiatrist part. It is the nutrition part. They will take care of it. So psychiatrists most of the time, because the proposed hypothesis of the neurotransmitter imbalance between the synapse is mostly predominating the scenario right now. So all the time we listen is the newer inventions, the newer approaches to the patient with a newer kind of drug, and the new approach with this thing, that thing. But I hardly listen to any kind of the food intervention in psychiatric illness. But yeah, we do hear about the food intervention in epilepsy as a ketogenic diet, which is since there in 90s from the 1920s. We do listen about this thing in dementias. We do listen it about in ADHD, but hardly in any psychiatric patients. No, not in India and hardly abroad. But from the last 1 2 years, we have started listening about this part also. It is a new emerging part. Eventually, it will take into the right kind of path and stream in the mainline stream. The food is also very important.
So what is your view on the work done by some of the international leading experts like Georgia Eid, Chris Palmer, Shebani Shetty from Stanford, from Harvard, on the ketogenic diet application in bipolar, in schizo? There are also studies which shows that ketogenic diet may be useful in food addiction part also, and even in drug addiction part also. There are case report and studies, though there are no extensive research on this. So what is your view on all this, both this addiction part and the mental health part?
Definitely, definitely. I know most of them personally. Also, all these guys are doing excellent work. Like the Shabani Sethi's work is rated as most 10 important research papers by the Stanford in year 2024. So when these kind of papers and when this kind of research is highlighted by the special or the prestigious universities, the psychiatric bodies, the psychiatric and the know-hows will definitely like try to implement those things. But as you know, there are so many issues with these kind of approaches. Eventually, they will take place. I mean, it is high time now when the patients had started asking us like why I get sick, and the psychiatrist has got no answer. And when you are going to stop the drug, the psychiatrist has got no answer. And believe me, like it is 90%, it is the patient who pushes us to taper the drug. He pushes us to stop the drug. The psychiatrist is not ready to stop or taper the drug, because like in our training it is we are trained to only write the drugs, to start the drugs. We are not trained to stop the drugs. So you have to take the drug. And the patient keeps on asking, and most of the time the psychiatrist has got no answer. If he does it, he does it with his own personal skill. And the food part is not taken care. But as more and more psychiatrists are willing to tackle this kind of issues, the work done by Dr. Georgia and by the Sherbani Sethi are excellent. The Chris Palmer has done the work, I mean, the amazing thing, and they are loud about their work now, and people are listening and thinking about it and reading about it, and they are ready to experiment. I told you the psychiatry is the most flexible branch in whole of the medicine field. I mean, the psychiatrist will take care of it eventually when more and more people will talk in a real sense, in the real physical world, not on only on the Twitter word. Eventually, this will start because the psychiatric illness. I always say that it has got the four legs. I mean, the four pillars. The first thing is the medicines. The pharmaco part is very much important because there is a definite evidence, the very solid evidence, the clinical evidences that there is a disturbance in the neurotransmitters inside the synapses and inside the brain, which needs to be settled down. And these drugs definitely settle those kind of issues. That is the one part. The second part is the psychotherapy part. The psychotherapy part works equally well as that of antidepressants. The studies have clearly shown that the good psychotherapy works side by side or same as effects as that of the TCS antidepressants. And the third part now is the food and the holistic part, which is very important now. Like the food part, you have to take care of it. The reason why the person gets sick because of the metabolic dysfunction, and how you can change the outcome of the psychiatric disease by just intervening into that metabolic dysfunction, and the changing the outcome of the disease by the metabolic settlement of the body, metabolic equilibrium of the body. And the fourth part is the lifestyle part, which includes all your resistance trainings, your exercise, your family sport, your non-abusive relationships, and everything. When these all four things just they do side by side, they work together, the outcome is excellent. If you are into only one, like then the approach is not right, and the outcome will not be the perfect one. I always say that we always say that Never try to taper your drugs. Never try to stop your drugs just by listening to the health coaches or the food coaches or the psychotherapist or babas and everyone who is talking about, or the gym guys, or also these alcoholic group. Just take 2 packs at the night and you will not be having any kind of psychiatric illness. Never do it. Never do it. Always consult your psychiatrist. Always consult your health coaches. Always consult your food coaches. The people who are into the keto diet programs, like there's so many on DLF platform. Consult them and make a proper regime. How to taper the drug, how to start your food, how to change your diet, how to start a ketogenic diet. So it is a complete approach, not the single approach will work.
Yeah, that's very true. And no, we have seen some people get adverse effect when they complete drop of medication. And de-prescribing psychiatric drug is an art only a doctor knows.
Absolutely.
So yeah,
Absolutely.
so I do look after a lot of mental health cases, and I know the reluctance of many of the psychiatrists that they cannot imagine lowering of any medication. Many of them say no. So that's why most of my cases goes to you, and then I tell them to please get in touch with Dr. Parikshit Sharma because he is not averse to tapering of the medication. So I think it has to be done very scientifically designed, and only a qualified medical practitioner and that two psychiatrists can only know what drug will work. And there are sometimes we require bridge medication also. So it
Yeah.
is not that medication is not useful or something. No, even in low carb ketogenic, that bridge medications are required for which you are there and you will help. Now, what is your experience of low carb diet in some of your cases which you handle?
So one thing, like when I
So,
wanted to
so
become.
I want in two perspective. One is on the ketogenic front, and one is on the lower carb. Maybe say, as Anup Singh says, 100 grams. Have you ever tried that? I don't know. So in the low carb and ketogenic, how do you see the difference?
Okay. The good question. Good question. I mean, it is very much relevant in our part of the world. See, I practice psychiatry, and the psychiatry is the part where we deal most of the time with the belief system of the patients. It is not just check the blood pressure. Your this is high and take this drug and go get out of my chamber. No, it's not like that. We talk a lot with the patients and we get to know the belief system. Mind it, it is the Indian population who will visit all over the world. They will go to the Japan and they will find the butter naan over there. They will go to the like Nicaragua and they just want to see the kadai paneer over there. And they will go to the Korea and they will not going to eat the Korean food. They will just look for the chole bhature. So Indian are very, I mean, rigid about their diets. They are very rigid. So we have to see um, what kind of approach we give to the patient, where he is ready to accept our the food guidelines or the food recommendations. Because in my mind, it is very clear that they are very rigid. They are not going to accept it because there is a concept in our communities about the God. There is a concept in our community about the fate, and there is a concept about the drugs and the doctors and the babas, that he will find a Baba, he will put just a hand on my head and all the problem will go away. And there is a doctor who will, I'm just looking for the doctor, I'm not able to get it. One day I will get a doctor who will just give me a one shot of an injection and my problem will be gone. So the people are into that kind of mindset because it is a belief system who is pushing them to not change about their thinking prospect, and they are not ready to experiment much. So we have to start from the very basics. From the very basics, if we start a patient, we can see the patient came with like the 10-year history of the depression, the comorbid depression, along with the diabetes and their comorbid hypertension. He's obese and all the functions are disturbed, and he's already on antidepressant drug from the so many doctors. So now he came to you as a psychiatrist to get a consultation because he just wants to get rid of all the drugs. So he is coming to you and you just say, like, you start the ketogenic diet. No, it's not possible. It's not possible. Like, it's 40 years. He is on having a good of his food, and he just described, I'm a very foodie person. So no, this is new kind of fact. Like the foodie person, people spend so much time just looking at the social media, only the food
Yeah.
reels. तो भैया क्या डाला इसमें, अमूल जाएगा भैया, क्या डाल रहे हो? Those kind of stuff, this is stuck in their brain. So when the patient comes to us, like, and we diagnose it like that, there is a gross metabolic disturbance in all the blood reports and the blood work, as well as we can see that the patient morphologically is clearly showing that he is having issues metabolically. So we start with the very basic. We just say him to cut on the sugars first. Stop eating sugars, any kind. Not even good. No suckers. No nothing. So no this fag of the natural sugars kind of things. We just started with this. Like you are not going to take any kind of sugars. So sugars are absolutely zero, zero, zero. And they say like, sir, thoda to dal do, sir, main to light sa peeta hu. So
Hmm.
there is nothing like light. There is always yes, there is always no. We just say no, no, and we try to dominate the person. If we are pushing this thing, then the doctor should be very clear about the outcome. That this thing will definitely gonna work, and we just keep on pushing the patient. Like if you are not gonna do this, your medication will not stop. You are not gonna be okay. If medicine can cure you, you must be okay after taking 10 years of medication. Why are you not okay? Then there is some problem. Stop taking the sugars. And he just tries it. He just stops taking the sugars. Say after like 4 weeks, 3 weeks, he again, confident now, like I can do it. And if I stop sugar, I'm not, my sugar will not go down. And he's very scared, like that the sugar will go down and I will die because some random guy died because of the low sugars. So then after 4 weeks, we start pushing them about stopping the processed flour and all the processed food. Like they are very fond of bread, they are very fond of rusk, very fond of eating those biscuits, Parle-G and all. So we push them to stop that now, and we keep on pushing like zero sugars and this thing. Now they eventually they stop it, and then we start pushing them for the grains. Stop eating grains, stop eating grains. You can add the alternative grains which are low in glycemic index, like you could take the besan with add with like the moong chilla and all. And they again do it, and eventually their symptoms started to improve, like just by stopping sugars. Their anxiety symptoms, their sleep pattern goes better, and their mood part and their other the parameters we just see in the depression prognosis, they start to improve. And the patients themselves feel like, sir, I feel confident. I used to like very afraid of all the things. Now I feel, sir, confident. Now I can handle my store. Now I can handle my farmland very well, sir. And then he also gains the con. Then we start pushing to go to this Anoop's very famous less than or the maximum 100 grams of carbs, and advise them to use CGMs and check like how your food is killing you, because the previously you were taking poha in the morning or the oatmeal in the morning and you're feeling very healthy food, and see how your oatmeal is giving you the big spike. Again 100 milligram would put the patient on 100 milligram for another 2 3 months, and then again push them to go more lower to 50, and eventually put the patient on the more protein diets, and we keep on so at that time, like the patient anxiety part is better, the patient has more confidence on the psychiatrist, and the things are improving. We start pushing him for the better lifestyle, and definitely that low carb diet is the base which is to be followed throughout the life to keep them happy and healthy. So eventually we reach that point. The population is very resistant to change the food habit, is not a joke, especially in India where we are so stuck to our the basic food. So the psychiatrist who just pushes, who just talks, and take the patient along on a treatment ship, that I am not only the driver, you are also co-driver. We will cooperate together, and we will eventually win this disease. And then that sense of enlightenment definitely helps them, and they get over it. See, I always see to all my colleagues and all my friends, there are only like in 140 crore of Indians, only the 2 crore who are paying income tax and everything. Imagine what 138 crore is doing. So that is the real India. You are only focusing on those like 2 crores. Look at our chamber is filled with those 138. The only those 2 crores once come like make our 4 or 5% of our OPDs. The most of the patients are from the middle or lower middle class, or the farming class. So we need to take care of them very well and talk to them according to their thing. If we say like start some the dry fruits, which is 3,000 kilos per day and everything, they can't do it. So we are not adding any kind of costly stuff. We are just trying to do the aversion thing, not diversion thing, but the aversion thing, to stop these kind of bad foods and eventually add more and more of proteins into your food, eggs and meats and everything. So that's the key.
Do you have any personal story, your own story of recovering health, or were you addicted to food? How have you become more healthier by adopting lowering down carbohydrates or getting off processed food?
Absolutely, wow. So the doctor should be firstly sure about his own research. The doctor should be sure about on his own methodology of working. So he should try this firstly on his own, on my own food and everything. And if I am convinced that the things which they are saying is correct, only then I can implement on my patients. Like, see, I am confident now. In Corona days, we were having lots of issues, and we were doing a lot of hell lot of the Zoom consultations and everything. And we were just sitting, and the families are at home and they're making good foods, and we were just putting the food. Wow, what a golgappa! What a great thing, and everything we were eating. And eventually, I put on weight. And when I went to the general checkup and everything, it is to my surprise, like my fasting sugar was 280. Yeah, and the HbA1c was 13, and the weight was 95. Oh my God, I was surprised. Like, what happened to me? Like, I never ate sugars. I never had bad food. What happened to me? Like, and I was like vegetarian. I was not eating eggs and nothing. Only the vegetarian. I was feeling proud about it
Oh,
in year 2020, like the Corona days. Then the thing started to change. And I just opted the low carb diets, which I studied a lot, which I was doing, and eventually, step by step, it is a journey. See, it is not a jump from the top building to the lower building, from the top mala to low mala. It's not like that. It is a process. So people have to learn it. This is a process. You do it every day. You do it every day. You do it every day, and eventually whole of your body will change. I went to the dermatologist. He put me on the drugs, and I was very keen to take the drugs. Oh yes, I got the drugs and I will be okay. Then I started to change all my diet, and eventually I put myself on the low carb diets and started eating eggs. And now I see also to the patients, egg is just like the milk. When you are getting the milk from the cow, you are not doing any kind of violence to the cow. You are not putting any harm to the cow. You are not making cow bleed anything. So it is there for you to drink. Same is with the poultry eggs. You are not killing it. You're not killing the hen. You are not killing any kind of embryo. There is no baby inside the egg. So egg is 100% vegetarian, because your basic criteria of vegetarianism is still there. So everything. So started eating eggs and the plenty of eggs, and reduced everything stepwise. Now I am on less than 50 gram of carbs per day, high on proteins, high on fats also, and only on 500 milligrams of metformin. Stopped every drug. My endocrinologist just got up from the chair and tapped me on my shoulders. Wow, doctor, wow, you are a story now. and the remission is 100% possible. Like as OTPDs are below normal now, and LFT is 100% normal. My HOMA IR is 1.1, and everything is excellent. So the mood is excellent, the energy is excellent. I don't feel sleepy at all, and what a wonderful journey it is. So it is there for rest of my life. My weight gone more than 20 kgs. I'm 74, 75 now, perfectly fit on a resistance training, and what a wonderful journey it is.
For how
Thanks
many
to
years?
thanks to
For
your
how many years?
encouragement.
For how many years are you on low carb?
It is more than 3 years now.
3 years. Fine. So I want to get the originator of 100 grams of carb for India, Anup Singh, inside. Please get
Welcome.
Anup inside. Yeah, Anup, welcome.
Yeah. Good morning, Dr.
Good
Parikshit.
morning.
You know,
Good morning.
first mention of Anup Singh's 100-gram carb, if I remember correctly, was on Twitter
Absolutely.
Spaces, right?
Absolutely. Absolutely.
It's it's so heartening, I would say, not exactly heartening, but so satisfying when such endorsement comes from a mainstream doctor. And now that is picking up pace because just yesterday we had two stalwarts also, talking about D-Life, and one of them is intrigued that how come this 100 grams carb per day limit that I set in 2011 is working, and how do we manage, right? So possibly we'll be going to his podcast soon. Possibly we are going to face tough questions on how we manage on 100 grams carb. And yes, it was very nice, listening to you. And especially as you mentioned, 3 points I would like to highlight. You mentioned about it's not a, jump from one floor to another. Rightly so, because when we formulated, transitioning from high carb to low carb, we had a strict 3-week transition schedule. And reasons for that are very evident. We don't have time. Otherwise, we could have, delivered a lecture, 1 hour lecture for it. And the second point is, milk and egg. Now, this vegan propaganda is absolute nonsense. If any vegan can sit on that egg and hatch it even in his lifetime, I would, go by their all that propaganda that they indulge in. And last point that I would like to, see such words coming from doctors is don't say remission, say reversal, right? And I say reversal because I challenge the best of, experts that please show me the science of 60% carbohydrate in diet. If it is not a science, then I have reversed my diabetes. And congratulations for, running third year into this magnificent, I would say, lifestyle. And coming from a doctor, I think nothing more could have been expected on a positive note from the medical fraternity. Yes, the population of such doctors, are very less, but we are confident, as we move forward, uh, many would like to replicate your success story, mine, Shashi's. That's how we grew from 2011 to now. It's almost 10 plus years. So thank you. Thank you very much, for mentioning again and again that 100 gram carb limit now, which should become global standard. Thank you.
Absolutely.
And
Absolutely.
also, for
Absolutely.
your information, Anup Singh has completed 14 years of pill-free diabetes
Oh,
on
that's great.
Friday. On Friday.
That's great. That's great. That's
This
great. That's
even
great.
this
I
So,
think
even
I
so,
would.
for
so the more thing, while I like to mention over here in our research paper, we are gonna write your name, the
Thank
DLF,
you.
and everything, like how they approached and how they, enlighten the people to start this kind of lifestyle, and how we are pushing this thing. Don't take it just by as a mark. Like I know this 100 grams comes from that glycogen liver base and everything. So it is not just a number. It has got some scientific basis also.
Right.
So even if it is 100 milligram, which is still very difficult for general population, but it is very easy to follow.
Yes.
That it is not like the people generally ask, like 100 million, sir, मैं तो भूखा मर जाऊंगा सर, मैं खाऊंगा क्या? So this is not thing like you are eating wrong things. There are plenty of other things to eat. But what you said, like the vegan propaganda and everything.
We got disconnected.
he will come. There's a phone call which has gone. He'll come. I think by mistake he entered the call. He'll come. I think it is inspiring to hear his own story that he has.
Yes, oh yes.
And he is currently conducting a study, and he is going to include the name of DLife also in that. Please get
Okay.
Dr. Parikshit in.
Yeah. Yeah, sorry, there was some
Yeah.
call. But I say, like, this is not a vegan propaganda. We should not, judge vegans as such, because I was also very vegan. The problem with veganism is not that they are pushing the agenda. I think if we see it socially or politically, this is political driven agendas. See, the protein is very costly stuff. The lamb will cost you around 800 rupees per kilogram, and if you want a dinner for four, you need 250 grams, and like 1,000 rupees a dinner, which means like 30,000-40,000 rupees dinner, and like you have to do all other kind of household things. So for every
Parikshit,
family, you need
if I
like
can,
150,000 rupees.
yeah,
So
if I
which is
can
not
intervene,
possible.
if I can intervene,
Yep.
as per survey, a typical diabetic spends around 15 lakhs in 20 years.
Oh my God.
Now,
Yeah, for sure, for sure.
and then if you divide that number to per month, it comes to somewhere around, I think, 6,500 or 7,000 something, 7,000 odd. Now, if 7,000 odd is spent only on meat, how many kgs of meat can we buy?
Absolutely, absolutely. This is very scientific, but what I see, like as a psychiatrist, we not only see the effect, we also see the social cause of it. Why this is done, why it is implemented or put in our brain in Indian society. It is done by our kings, our politicians. They just want to give you that 20 rupees kg grains, and they just want to give you that 5 chapatis, eat everyone, fill your cavities and sleep well and die early. So 20 rupees is very easy for them, like dal atta schemes and everything you are saying. Like, you're not getting any kind of meat dal scheme or egg dal schemes. It is dal atta schemes. So it is very easy for the population to feed, because it is the hungry population which will revolt and fight. Another thing which I see, I don't know the basis of it, but mm, the sugars are highly subsidized
Yes.
food in the world. Highly subsidized food in the world. You generally see like how other food stuff has done with this the rates have gone up. Even the Tata salt, which used to be 2 rupees a pack in 2000, now it is 40 rupees. But the sugar has not increased in that way, because the government is putting lot of subsidies. The reason, scientific proven now, is the sugars make you more coward. The sugars make you feel depressed, anxious. So they feel like, no, I will don't do anything. The police will call me, like they will put me in jail. I will not go out and protest and everything. So they want you to be like cowards. They don't want you to be brave. They don't want you to have courage. So they push you on the sugars, and all time, from morning to evening. So they push you on sugars, and eventually you see the things, how the world has changed, how the people are so scary, and they are not ready to take any new thing and courage. So one thing is definitely there, like, and those kings. I was reading a book, The Wonder Called India, by like some English author. I forget the name. It was written in 1930s by the English author, and he wrote about the Ashoka the Great, that how he changed everything from in India, from this thing to the vegetarianism. But he was not doing any kind of vegetarianism himself, because there is no evidence that they were showing that there was less quantity of meat going inside the palace or something. He was having good time, but he was just trying to control the population with all this stuff. And all these vegetarianism came with us, with all this Buddhism and everything, and how the Hinduism adopted it, because we remained vegetarian for more than 400 years in under the influence of Buddhism. And when we again reconverted to the Sanatana in the late 800s, and that habit of eating or being the vegetarian remained, but we converted. So this is all the social things, social political things, which influenced us. But when now I start and influence, saying patient that take more eggs, start eating meat, start eating fish, start eating this, and they are ready eventually to start it. because I just take the ownership that all the karmas and all the paps are mine now. You just say to the God that it is the doctor who gave us this medicine to take fish or take meat, and but eventually I know when you will get healed, I will also get the punyas of your patient that I treated them very well. So the general public, the general population is now ready to change. They now accept it that the food is the reason, and there are popular examples. जैसा खाओगे अन्न वैसा हो जाएगा मन, and like the way you eat the food, your mind will change. And दाने दाने पे लिखा खाने वाले का नाम. You will eat more grains and you will die early. So
Thank you.
don't eat grains. Don't eat grains.
Thank you, Doc. Thank you. And we will invite you again for a podcast with DLF and have little extensive discussion because you have wealth of knowledge.